we're going to be focusing on age-related pains, and our doctors have some detailed information about it, so don't miss it.
Now, that's a real good question because, a large percentage of people as we get older develop knee pain. I myself are beginning to get pain on the right knee. So what causes it? It could be a combination of just straining your knee. So if you twist it, if you step wrong and the knee bends in a certain way, you might pull your ligaments and that causes pain. Anything that makes something malfunction, like a joint, like the joint is like a finger joint, the knee one, it can only go forward and backward. It doesn't go sideways. But if you step wrong and you twist it sideways, then you're going to pull the ligament. All ligaments, all the tissues in our body have nerves, and so if you irritate the nerves, it's going to cause pain. That's the way God made us, so that we can respond to the injuries and avoid them. Obviously, that's what we want to do. But so that's one of the reasons. That's one thing that causes pain. The other thing that causes pain as we get older, or after a lot of trauma, the joint gets damaged. So the cartilage starts getting swollen, and the cartilage is like it's a cover. It's white. If you see it in when you're eating chicken, you see that tissue between the bones, the joints. That white is cartilage. So our knees have cartilage, and the bones are covered with cartilage, and the other bone when it rubs, it is very smooth. And between the cartilage, there is a tiny little film, and it covers both sides. So there's a tiny amount of space that has a little bit of fluid in it, just a small amount. That's a lubricant, very, very slippery, like oil, like STP. And so when the process of degeneration, that has to do with aging, you're getting old, or trauma that damages this structure, it no longer produces the correct liquid like it should, and the surface starts getting swollen. It becomes irregular and rough. So now there's rubbing against the joint, against these two surfaces, and that's going to cause pain. If you don't have enough fluid in the joint, it causes pain. If you have too much, it also causes pain, because then it stimulates by extension, it irritates the nerves. So there's a lot of things that cause the pain. Pain becomes present at different ages in the body. It depends on the person. Some people get pain when they're young, if they have an injury again. It depends how bad the injury or the trauma is, and then depends on how old the person is. So pain is relative. Some people are 90 years old, they have no pain in the knees. So that's very personal and individual. Okay, the symptoms are pain. The other symptom is stiffness. You feel that the knee is stiff and it no longer functions. The other symptom that people get is they might feel that they're unsteady on their legs. Loss of balance can occur as well. Arthritis can cause loss of balance as well because of the way the knees function. The other thing is pain. That's one of the main symptoms, a lot of pain. The other signs and symptoms in medicine. Signs are falls. You fall down because your knee gave way, and then you just hurt more. So those are the main things. Well, when it's something that's starting out, one way to treat it is sometimes rest. If you overuse it, rest a little bit. Some people are doing a lot of exercise, so they start getting the pain. Rest it and put some ice on it if it's something acute. If it is chronic pain that has been present for days and days, it's good to take the anti-inflammatories they sell over the counter, like Aleve, Motrin, all these kind of medicines, ibuprofen, and Tylenol. All of these medicines, although Tylenol is not an anti-inflammatory, but it takes pain away. And sometimes once you take pain away, you just feel so much better. Okay, if you have pain in the joints due to arthritis, the reason you should come see us is because we have a lot of experience treating this kind of problem. We have a special technique, we're not the only ones in the world, of course, but it's a special technique that not all physicians have available. It's called fluoroscopy. So when we're doing an injection of the knee, we can see it on this computer screen, and we can see it in real life. In other words, we can see it live as we're doing the procedure. We can see as the needle goes in, and when we do this procedure, we inject a dye into the space. That doesn't hurt, okay? but the dye shows up on the x-ray on the screen that the dye is exactly in the space that we need. It's called the synovial space. That's a space that is between both of the bones, right in this little space that is between it that has a little bit of fluid. So we inject the fluid in there. We can see that we're in the right place. We leave that needle there, we take the syringe out, and then we inject the medicine. Either it's a cortisone shot, or if it's the hyaluronic or any of these other hyaluronic acid substances that we put in, and it goes right into the correct space. So that's why we do it different, and that's why we have tremendous success with our program.
So I hope you find this information very helpful. If you have any questions, just comment below, or if you are suffering from any pain, or you or your family or a friend, don't forget to let them know, share this video. And if you need to see our doctors, you can always call our office, 956-668-0044. Remember, we're located in McAllen. And you can also visit our website to get more information about our services at familypracticecenter.com. Until next time, guys. Bye.